As health workers in the US struggle to give COVID vaccines to Americans who are hesitant or even resistant, others around the world are not only willing to get vaccinated but making the extra effort to do so. Suli Razak flew halfway around the world from Indonesia.
Memang anak saya kuliah di sini.
My children go to college here. After some consideration, we decided to get the vaccine in the US while visiting our children.
Like many countries around the world, vaccine rollout has struggled to catch up with demand in Indonesia, currently experiencing a spike in COVID cases, including the more infectious Delta variant. So in June, along with her husband and 16-year-old daughter, Suli Razak boarded a 21-hour flight from Jakarta to New York. 2 days later, they got their first Pfizer shot at the local pharmacy in Stroudsburg, Pennsylvania.
Before coming here, we've got some information saying that it was easy to get vaccinated. Turns out it was really easy.
Meanwhile, Angky Banggaditya, visiting New York City from Jakarta in March, managed to get the one-shot vaccine Johnson & Johnson just a couple days before heading back to Indonesia. The city had opened vaccinations to non-residents as part of attempts to boost tourism.
I wasn't sure I was going to immediately get it. I kept having to refresh the page for the appointment. It took 3 to 4 days to get a vaccination appointment.
At least 24 US states do not require proof of residency for COVID-19 vaccination. For travel agents in Indonesia, this has become an opportunity to revive their businesses, hit hard by the pandemic. They are offering tour packages to get vaccinated in the US.
We have more than 30 people lining up.
The tour packages range from a $550 deal, a 4-day trip to Hawaii, to the luxurious 52-day cross-country trip costing $3,600. The availability of so many vaccines in the US with a higher efficacy rate than the Chinese-produced vaccines primarily used in Indonesia is one draw for vaccine tourism.
The vaccine approved in such countries are like Pfizer, Johnson & Johnson. We don't have those in Indonesia yet. So I thought to myself, why not travel and get vaccinated at the same time?
Vaccine tourism also faces ethical concerns regarding access.
That does create disparities because the same group of people from the country, some may be able to afford to do that while others would not be able to.
So far, the WHO Global Vaccine Sharing Program, COVAX, has shipped out at least 105 million doses to 135 lower to middle-income countries. The anti-poverty advocacy group One Campaign notes that only 1% of COVID vaccines worldwide have gone to lower-income countries and have called on industrialized countries to hasten vaccine sharing with the rest of the world. In Washington, D.C., Virginia Gunawan, VOA News.